Hi, I'm Dr. Pam Brown. I'm a GP in Swansea and I also work in an osteoporosis clinic in the hospital in Swansea. Our bones grow throughout the early part of life, and then later in life, from about the mid-30s onwards, we begin to lose bone. So it's important that we've got lots of bone in our skeleton at that stage. Our bones are healthy because they provide us with support and allow us to protect some of the organs within our body that are really important. And the main reason for keeping our bones healthy is so that we don't have fractures or broken bones, particularly later in life. The way that we can protect them is to lead a healthy lifestyle throughout life, really from the cradle to the grave. So that involves eating a healthy diet which is rich in calcium, having plenty of sunlight exposure to make vitamin D in our skin, and ensuring that we take vigorous exercise early in life and more gentle exercise to stop us from having falls later in life. The ideal exercise is resistance type exercise that we can do in the gym or doing aerobics where we're actually stressing the bones in our skeleton quite a lot. Calcium is an important component of bone along with protein and other fibre type structures that make the bones strong. We can get lots of calcium, particularly from dairy produce. Skimmed milk contains more calcium than full fat milk, so we can drink plenty of milk and protect our bones while still protecting our heart and sticking to a low fat diet. We also can get calcium from other sources like calcium added soya milk if we're not able to take dairy produce, and a variety of green leafy vegetables have got calcium as well, although that's a little bit more difficult to get large quantities. The main health problems associated with bones are osteoporosis, where the bones become thinner and much more fragile. And this begins to happen from about the 50s onwards in many people. We also have problems with joints which are completely separate, and it is important to differentiate between osteoarthritis, which affects our joints and causes pain, and osteoporosis, which affects our bones, our skeleton. In terms of symptoms for osteoporosis, usually there aren't any until someone has their first fracture, and that silent nature of the underlying disease while the bones are getting thinner is really a problem and makes it hard for people to know whether they've got the disease. When somebody begins to develop osteoporosis, usually it starts off very mildly and the progression can take many, many years. Although sometimes, particularly in men, osteoporosis can progress very rapidly so that people start having one fracture and then very quickly thereafter have further fractures. Even at the late stages where someone's had a lot of fractures, there's still much that can be done to treat the condition and prevent further fractures. There are four main groups of treatments that we can use for osteoporosis. The first of those is calcium and vitamin D taken in high dose as a supplement, as opposed to getting calcium from the diet and vitamin D from sunlight exposure. And really anybody that has osteoporosis or needs treatment for their osteoporosis to prevent fractures should have calcium and vitamin D along with another treatment. The next category and the commonest drugs that are used are bisphosphonates, and these are a tablet that's taken once a week generally or once a month, but it has to be taken in a very careful way to make sure that the drug is absorbed and has a benefit for protecting bones. So in summary, it's really important to do the lifestyle advice throughout life: healthy diet, good exercise, avoiding smoking and moderating alcohol. And the really good news is that we have such a huge range of drug treatments available for osteoporosis that once you've had a fracture and you seek the correct diagnosis, we can always do something to reduce your risk of future fractures. So it's really worth seeing your doctor or your nurse and talking about your individual risk.